The X-ray plate slides onto the lightbox with a soft click, and the doctor goes completely still. There are 6 bright white spots scattered across the image of the prisoner's torso and left arm. 6 pieces of metal, still inside his body. The prisoner's name is Johann. He is 21 years old. He has been walking, working, and living with these shrapnel fragments embedded in his muscles and tissue for 9 months. The doctor, Captain Robert Hayes, counts the pieces again to make sure he is not seeing things. 1 in the left shoulder, 2 in the upper chest near the ribs, 1 in the left bicep, 2 more in the lower back. 6 pieces total. But the shocking part is not that Johann has carried shrapnel for 9 months. The shocking part is that he never told anyone, never complained, and never sought treatment. He thought it was normal. We are at Camp Ruston in Louisiana in May 1945, just days after Germany's unconditional surrender. The camp holds approximately 4,000 German prisoners of war, mostly captured during the final months of fighting in Europe. The prisoners are processed through a standard intake procedure that includes medical screening, delousing, and assignment to barracks. The medical screening is supposed to identify injuries, illnesses, and chronic conditions that require treatment. Most screenings are quick and unremarkable. Check vital signs, look for obvious wounds or infections, fill out a health form, and move to the next prisoner. Johann's screening is supposed to be routine. It is anything but. Johann arrives at Camp Ruston on a warm May afternoon as part of a group of 200 prisoners transferred from a processing center in New York. He walks off the transport truck under his own power, carrying his small bundle of belongings. He looks healthy at first glance. 21 years old, 5 feet 9 inches tall, 138 pounds, no visible signs of injury or illness. He moves through the intake line without drawing attention. But when he reaches the medical station and removes his shirt for the physical examination, Captain Robert Hayes notices something unusual. There are multiple scars on Johann's left shoulder, chest, and arm. The scars are old, well-healed, but they have a particular pattern that Hayes recognizes from his experience treating combat wounds. These are shrapnel entry wounds. Hayes asks Johann through an interpreter, Sergeant David Klein, when he was wounded. Johann says it happened in August 1944 during fighting in France. Hayes asks if the wounds were treated. Johann says a medic bandaged them and they healed on their own. Hayes asks if any shrapnel was removed. Johann pauses and says he does not think so. The medic just stopped the bleeding and wrapped the wounds. Hayes feels a cold certainty forming in his gut. He has seen this before. Shrapnel fragments left inside because battlefield conditions did not allow for proper surgical care. He orders an X-ray immediately. Johann is taken to the camp hospital's radiology room, and 20 minutes later, Hayes is staring at the X-ray plate that shows 6 bright white fragments still embedded in Johann's body. We are still in the camp hospital, and Hayes is conducting a more detailed examination of Johann now that he knows about the shrapnel. Johann is lying on an examination table, and Hayes is palpating the areas where the X-ray showed metal fragments. In the left shoulder, Hayes can feel a hard lump just below the skin, about the size of a small marble. That is the largest piece, lodged in the deltoid muscle. In the upper chest, there are 2 smaller pieces near the ribs, too deep to feel but visible on the X-ray. In the left bicep, there is another piece that Hayes can feel when he presses firmly. The 2 pieces in the lower back are the deepest, sitting near the spine but not touching it. Hayes estimates the sizes. The largest piece is probably 2 centimeters long, the smallest less than half a centimeter. All are irregular fragments of an artillery shell or mortar round. Hayes calls over his surgical colleague, Dr. Emily Carson, and shows her the X-ray. Carson looks at the image and asks the same question Hayes has been asking himself. How has Johann been functioning normally with all this metal inside him? Hayes explains that shrapnel can remain in the body for years without causing immediate problems if it does not hit vital organs or major blood vessels. The body often encapsulates the foreign objects in scar tissue, essentially walling them off. But leaving shrapnel in place carries risks. Infection, migration of fragments to more dangerous locations, chronic pain, and lead poisoning if the metal is toxic. The standard of care is to remove accessible fragments surgically. Johann should have had this surgery 9 months ago. Hayes asks Johann through Klein why he never sought treatment for the shrapnel. Johann looks confused by the question. He says the wounds healed, so he thought everything was fine. He has had some pain and stiffness in his left shoulder and back, but he assumed that was just part of recovery from being wounded. He did not know the shrapnel was still inside. No one ever told him. The medic who treated him in the field never mentioned it. The holding camps where Johann was processed before reaching the United States never gave him a thorough medical exam. Johann has been carrying 6 pieces of metal in his body for 9 months, completely unaware that this was not normal. Hayes realizes this is not just a medical case. This is a failure of the system. We are now in Hayes's office, and he is consulting with Carson about whether to operate on Johann. The decision is not straightforward. On one hand, leaving the shrapnel in place carries long-term risks. On the other hand, Johann has been asymptomatic for 9 months, which suggests the fragments are well encapsulated and stable. Surgery to remove them would require general anesthesia, incisions, tissue dissection, and recovery time. There is always a risk of complications with surgery. Hayes and Carson review the X-ray again and categorize each fragment. The piece in the left shoulder is accessible and should be removed. The piece in the bicep is also accessible. The 2 pieces in the upper chest are deeper and riskier to remove because they are near the ribs and potentially near the pleura, the membrane surrounding the lungs. The 2 pieces in the lower back are the most concerning because they are close to the spine. Removing them could cause nerve damage. Hayes decides on a staged approach. He will remove the 2 most accessible pieces, the ones in the shoulder and bicep, in a first surgery. If that goes well and Johann tolerates the procedure, he will consider a second surgery for the chest pieces. The back pieces will be left in place unless they start causing symptoms. Removing them carries too much risk for the potential benefit. Hayes explains the plan to Johann through Klein. Johann will have surgery to remove 2 pieces of shrapnel. The surgery will be done under general anesthesia and will take about 2 hours. There will be pain during recovery, and Johann will need to keep the surgical sites clean to prevent infection. Johann asks if the surgery is necessary. Hayes says it is not immediately life-threatening, but it is the right thing to do to prevent future problems. Johann agrees to the surgery. We are now waiting for Johann's surgery to be scheduled, and we need to go back to understand how he ended up with 6 pieces of shrapnel in his body. Let us go back 9 months to August 1944 in northern France. Johann was part of a Wehrmacht artillery unit that was caught in the Allied advance after the breakout from Normandy. His unit was positioned near a small town, firing artillery shells at American positions several miles away. The Americans responded with counter-battery fire, using their own artillery to target Johann's gun emplacements. One afternoon, an American shell landed directly on Johann's position. The explosion was catastrophic. 3 men in Johann's crew were killed instantly. Johann was knocked unconscious and buried under debris. When Johann woke up, he was lying in a crater, covered in dirt and blood. His left side was on fire with pain. He could not move his left arm. He looked down and saw blood soaking through his uniform in multiple places: shoulder, chest, arm, back. He tried to call for help but could barely breathe. Eventually, a German medic found him and pulled him out of the crater. The medic examined Johann's wounds and found at least 6 entry points where shrapnel had penetrated. The wounds were bleeding but not spurting, which meant no major arteries were hit. The medic applied pressure bandages to each wound, gave Johann a morphine injection, and told him he needed to get to a field hospital for surgery. But the field hospital was 10 miles behind the lines, and the roads were under constant attack by Allied aircraft. Johann was placed in a truck with other wounded men, but the truck never made it to the hospital. The driver got lost trying to avoid destroyed roads, and by the time he found his way, the German defensive lines had collapsed. The truck was stopped by American soldiers, and everyone inside was taken prisoner. Johann had been wounded 6 hours earlier. The morphine was wearing off. The pain was intense. An American medic looked at Johann's bandages, saw that the bleeding had stopped, and decided Johann was stable enough to wait. He was moved to a temporary holding area with dozens of other prisoners, and the waiting began. We are still tracing Johann's path, and now we follow him through 9 months of captivity with untreated shrapnel wounds. At the holding area, Johann waited for 3 days. His wounds hurt, but the pain was manageable. The bandages were not changed. There was no medical follow-up. On the fourth day, Johann was moved to a larger transit camp where a medic finally looked at his wounds. The medic removed the bandages and found that the wounds had begun to heal. There was no sign of infection, no redness, no pus. The entry points were scabbing over. The medic cleaned the wounds with antiseptic, applied fresh bandages, and moved on to the next patient. Johann asked if he needed surgery. The medic said the wounds looked fine and surgery was not necessary. Johann believed him. From the transit camp, Johann was moved to a processing center on the French coast. He spent 2 weeks there, sleeping in a tent with 200 other prisoners. The bandages came off after a week because the wounds had healed over. Johann was left with scars but no open wounds. The pain in his shoulder and back persisted, a dull ache that got worse when he moved certain ways. Johann assumed this was normal healing. In September 1944, Johann was loaded onto a ship bound for England. The voyage took 8 hours. At the processing center in England, Johann went through a cursory medical check that consisted of a visual inspection and a few questions. No one asked about his scars. No one took an X-ray. Johann was cleared as healthy. In October 1944, Johann was put on a transport ship to the United States. The voyage took 14 days. Johann worked in the ship's galley, peeling potatoes and washing dishes. The work aggravated the pain in his shoulder, but he pushed through it. When the ship docked in New York, Johann went through another medical screening. Again, it was cursory. Again, no one asked about the scars. Johann was sent by train to a camp in Arkansas, where he spent 6 months working on a farm detail. The physical labor was hard on his shoulder and back, but Johann adapted. He learned to favor his right side and avoid movements that caused sharp pain. Other prisoners noticed he was stiff and asked if he was injured. Johann said he was wounded in France, but it healed. No one suggested he see a doctor. And so Johann carried the shrapnel for 9 months, through multiple camps and thousands of miles, until he arrived at Camp Ruston and finally had an X-ray. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? We would love to know who is keeping these stories alive. We returned to Camp Ruston, and it is now 1 week after Johann's X-ray. The surgery is scheduled for a Thursday morning. Johann has been prepped. No food or water for 12 hours before the operation, a thorough shower with antibacterial soap, and a clean hospital gown. He is nervous but tries not to show it. He has never had surgery before. He has never been unconscious except when the shell exploded. The anesthesiologist, Captain Lewis Hoffman, explains the process. Johann will be given an injection that will make him fall asleep. He will not feel anything during the surgery. When he wakes up, it will be over. Johann nods and lies back on the gurney. Hayes and Carson scrub in and prepare the operating room. The plan is to remove the shrapnel from Johann's left shoulder first, then the piece in his bicep. 2 incisions, 2 extractions, minimal tissue damage. The surgery begins with the anesthesia. Hoffman administers sodium pentothal through an intravenous line, and Johann's eyes flutter closed within seconds. Hayes makes the first incision in Johann's shoulder, a 3-inch cut following the line of the deltoid muscle. He dissects carefully through the tissue layers until he reaches the shrapnel fragment. It is encased in a thick capsule of scar tissue, exactly as Hayes expected. He uses forceps to grasp the fragment and gently pulls it free. The metal piece is jagged and irregular, about 2 centimeters long, dark gray in color. Hayes drops it into a metal tray with a clink. 1 down. The second incision is on Johann's left bicep. Hayes cuts through skin and muscle and finds the second piece of shrapnel embedded deep in the tissue. This one is smaller, about 1 centimeter, but it is wedged between muscle fibers and harder to extract. Hayes works slowly and carefully, teasing the fragment out without tearing the surrounding tissue. After 10 minutes of delicate work, the fragment comes free. Hayes drops it into the tray next to the first piece. 2 down, 4 to go. But Hayes is not removing the other 4 today. He closes both incisions with sutures, applies sterile dressings, and steps back. The surgery has taken 90 minutes. Johann is stable. The fragments are out. Hayes holds up the tray with the 2 pieces of shrapnel and shows them to Carson. These were inside him for 9 months, Carson says quietly. Hayes nods. 9 months. If you are enjoying this story and want more untold accounts from World War II prisoners of war, make sure to subscribe to the channel. We are bringing you stories that most history books never covered. We are now in the post-operative recovery ward, and Johann is waking up from anesthesia. He is groggy and confused at first, asking in German where he is. Klein is there and reassures him the surgery is over and went well. Johann looks down at his shoulder and bicep, both heavily bandaged. He asks if the shrapnel is out. Klein says yes, 2 pieces were removed. Johann closes his eyes with relief. The pain will come later, but right now he just feels grateful. Over the next 3 days, Johann stays in the hospital under observation. The pain from the incisions is significant, a deep aching throb that morphine only partially relieves. The nurses change his dressings twice a day, checking for signs of infection. The wounds look clean. The sutures are holding. Johann is healing well. Hayes visits daily and examines the surgical sites. He tells Johann that the 2 pieces in his chest and the 2 in his back will stay in place for now. They are not causing immediate problems, and removing them would require more invasive surgery. Johann asks if they will cause problems later. Hayes says honestly that he does not know. Some people live their entire lives with shrapnel inside them without issues. Others develop chronic pain or infections. There is no way to predict. Johann will need to be monitored. By the end of the first week, Johann is cleared to leave the hospital and return to the prisoner barracks. He is given pain medication and instructions to keep the incisions clean and dry. He is exempt from work duty for 2 weeks to allow the wounds to heal. Hayes gives Johann a copy of his medical file that documents the shrapnel, the surgery, and the 4 remaining fragments. He tells Johann to keep this file and show it to any doctor he sees in the future. The remaining shrapnel could cause complications, and future doctors need to know it is there. Johann takes the file and thanks Hayes. It is a simple thank you, but it carries weight. Hayes saved Johann from potential future problems, and Johann knows it. We are now 2 months after Johann's surgery, and he is back to regular camp routines. The incisions have healed, leaving new scars on top of the old ones. Johann's left shoulder and arm are stiff and sore, but the pain is less than before the surgery. He is assigned to work in the camp vegetable garden, a job that requires moderate physical labor but is not as strenuous as farm work. Johann plants seeds, pulls weeds, and harvests vegetables. The work is manageable, and he adjusts to the limitations of his shoulder. But the 4 remaining pieces of shrapnel are always in the back of his mind. He can feel them sometimes, especially the ones in his back. When he bends certain ways, there is a sharp twinge that reminds him they are still there. Johann talks to other prisoners about his experience, and several of them share similar stories. One man has shrapnel in his leg from a mortar explosion. Another has a bullet fragment in his abdomen. None of them had surgery. They all just learned to live with it. Johann realizes that carrying shrapnel is more common than he thought. It is a consequence of the battlefield conditions where there was no time or resources for proper surgical care. Thousands of soldiers, on all sides, walked away from the war with metal fragments still inside them. Some had problems later, others never noticed. Johann is part of a hidden population of men living with the physical remnants of combat embedded in their bodies. Hayes continues to monitor Johann through periodic checkups. Every 6 weeks, Johann reports to the hospital for an examination. Hayes palpates the areas where the remaining shrapnel is located, checks for signs of infection or inflammation, and asks about pain levels. For the first 6 months, everything is stable. The fragments are not moving. There is no infection. The pain is manageable. But in month 7, Johann reports new pain in his lower back. Hayes examines him and finds tenderness over one of the shrapnel sites. An X-ray shows that the fragment has shifted slightly, moving closer to a nerve bundle. Hayes considers surgery but decides to wait and see if the pain resolves. He gives Johann anti-inflammatory medication and tells him to avoid heavy lifting. The pain decreases over the next few weeks and the crisis passes. The shrapnel is still there, but it is stable again. Let us pause Johann's story and look at the larger scale of embedded shrapnel among combat veterans. Medical records from World War II are incomplete, but estimates suggest that tens of thousands of soldiers on all sides carried shrapnel or bullet fragments in their bodies after the war ended. The exact number is unknown because many cases went undocumented. Battlefield medicine prioritized saving lives and preventing immediate complications. If a wound healed and the soldier could function, the embedded metal was often left in place. Removing every fragment would have required surgical resources that did not exist in field hospitals. The medical literature from the 1940s and 1950s contains numerous case studies of veterans living with embedded shrapnel. Some developed complications years or decades later: chronic pain, infections, lead toxicity from certain types of metal, and migration of fragments to dangerous locations. Others lived their entire lives with no problems. One study from 1952 followed 200 veterans with embedded shrapnel for 5 years and found that approximately 20% developed complications requiring surgical intervention. The other 80% remained asymptomatic. The study concluded that removal of deeply embedded fragments should be considered on a case-by-case basis, weighing the risks of surgery against the risks of leaving the metal in place. Johan's case fits this pattern. The 2 accessible pieces were removed, reducing his overall shrapnel burden and eliminating 2 potential sources of future complications. The 4 remaining pieces were left in place because the surgical risks outweighed the benefits. Hayes's decision was medically sound and followed the best practices of the time, but it also meant Johan would carry those fragments for the rest of his life. A permanent reminder of the August afternoon when an artillery shell exploded and changed his body forever. We are now in the summer of 1945, and the war has been over for several months. The camp atmosphere is shifting from wartime prisoner management to post-war repatriation planning. Prisoners wait for news about when they will be sent home. Johan waits along with everyone else, working in the garden, attending educational classes, and managing his chronic shoulder and back pain. He has received 2 letters from his family through the Red Cross. His parents and younger sister are alive and living in a displaced persons camp in the British occupation zone. Their house was destroyed in Allied bombing. They are waiting for housing and trying to rebuild. Johan's mother writes that she is grateful he survived and asks when he will come home. Johan does not know the answer. In October 1945, Johan is told he is approved for repatriation in a group leaving in November. He has mixed feelings. He wants to see his family, but he is nervous about returning to a destroyed country. Germany is occupied, divided, and economically devastated. Johan does not know what kind of work he will find or where he will live, but staying in the camp is not an option. The United States is emptying the camps and sending prisoners home. Johan prepares himself mentally for the transition. He packs his few belongings, including the medical file Hayes gave him. That file might be important someday. We are now in mid-November 1945, and Johan is boarding a transport ship in New Orleans bound for Europe. The voyage takes 2 weeks, and the conditions are adequate. Johan spends most of the time on deck, watching the ocean and thinking about the future. When the ship docks in Bremerhaven, Johan goes through the repatriation process. Interviews, identification checks, paperwork. He is cleared and given a train pass to the British zone. The train journey takes 4 days with multiple transfers and delays. When Johan finally reaches the displaced persons camp where his family is staying, he finds them living in a small room in a converted school building. The reunion is emotional. His mother cries. His sister, now a teenager, barely recognizes him. Johan is home, but home is not what it used to be. Johan spends the next few years helping his family survive in post-war Germany. He finds work as a laborer, clearing rubble and rebuilding infrastructure. The work is hard on his shoulder and back, but he pushes through the pain. In 1948, the pain in his lower back becomes severe enough that he sees a doctor. An X-ray confirms that one of the shrapnel fragments has shifted again. The doctor recommends surgery, but Johan declines. He has survived this long with the metal inside him, and he does not want to risk surgical complications. The doctor gives him pain medication and tells him to come back if the symptoms worsen. Johan learns to live with the pain. In 1950, Johan marries a local woman named Ingrid. They have 2 children over the next 5 years. Johan finds work as a warehouse supervisor, a job that is less physically demanding than construction. His shoulder and back pain continue but become manageable. He takes aspirin daily and avoids heavy lifting. In 1962, 17 years after the end of the war, one of the chest fragments causes a localized infection. Johann develops fever and pain in his upper chest. He sees a doctor who determines that the fragment has eroded through its scar tissue capsule and is causing inflammation. This time, Johann agrees to surgery. The fragment is removed and the infection clears. 3 pieces remain, 2 in his back and 1 in his chest. Johann lives with them for the rest of his life. Exam that shocked everyone at Camp Rustin. He carries 3 pieces of shrapnel in his body until the end. The metal never fully integrates with his tissue. It remains foreign, walled off by scar tissue, a permanent reminder of the war. Johann's children and grandchildren know about the shrapnel. He shows them the scars and tells them the story occasionally, usually when they ask about his stiff shoulder or why he cannot lift heavy objects. The story becomes part of the family history, passed down through generations. What does Johann's story tell us about World War II and the medical treatment of wounded soldiers? On one level, it is a story about battlefield triage and the limitations of field medicine. Johann's wounds were treated enough to save his life, but not thoroughly enough to remove all the shrapnel. In the chaos of combat and the collapse of German defensive lines, there was no time or resources for proper surgery. Johann fell through the cracks of a system that prioritized immediate survival over long-term care. The fact that he carried the shrapnel for 9 months before anyone discovered it reveals how incomplete medical screening was in the prisoner transport system. On another level, Johann's story is about adaptation and endurance. He lived with pain and limitation for over 50 years, adapting his work and his movements to accommodate the metal in his body. He raised a family, built a career, and contributed to his community despite the permanent damage from that August afternoon in 1944. The shrapnel shaped his life, but it did not define it. Johann was more than the metal inside him. The medical exam that shocked everyone at Camp Rustin was shocking because it revealed something that should not have been. 6 pieces of shrapnel left inside a young man's body for 9 months. The shock was not just medical but systemic. It raised questions about how many other prisoners were carrying similar burdens, undiagnosed and untreated. Dr. Hayes's decision to operate and remove 2 of the fragments was the right call, but it came 9 months too late. The other 4 fragments stayed with Johann for life, a permanent legacy of a war that ended but never fully let go of the men who fought it.